Well, welcome everyone, and thank you for joining our webinar today on ReEmerging Outbreaks, Ebola, Measles, now Zika, what's next? And that's with Jones and Bartlett Learning authors Sharon Buchbinder and Nancy Shanks. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones and Bartlett Learning. And for those of you who are not familiar with Jones and Bartlett, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. Before I introduce you to Dr. Buchbinder and Dr. Shanks, let me just touch on a couple of housekeeping items. First off, the formal part of the presentation will last about 30 minutes, and following that, you'll have a chance to ask questions. This will be an interactive session, so at a couple of points, we'll ask for your feedback by having you use the feedback button, which is also on the right side of your screen. So now let me introduce you to our speakers, Sharon Buchbinder and Nancy Shanks. Sharon Buchbinder is Professor and Program Coordinator for the MS in Healthcare Management at Stevenson University, and that's in the Graduate and Professional School. She is also the former chair of the Association of University Programs in Health Administration and the author of 3 books from Jones and Bartlett Learning, Introduction to Healthcare Management, which she co-authors with Nancy Shanks, Cases in Healthcare Management, and Career Opportunities in Healthcare Management. Nancy Shanks is Professor Emeritus in the Department of Health Professions in the Healthcare Management Program at Metropolitan State University of Denver. Dr. Shanks has taught a variety of undergraduate courses in health services management, organization, research, human resources, management, strategic management, and law. Dr. Shanks' research interests have focused on health policy issues such as providing access to health care for the uninsured. So with that, I'm going to go ahead and hand the reins over to Dr. Buchbinder.
Thank you very much. It's really a pleasure to be here today. I'm with a small army of our closest friends on the internet. I'm delighted to have this opportunity to present on what I think is a timely topic. Almost everything in this presentation is covered in our textbook in Chapter 17, except for the Zika material, which Nancy will be covering later on in the presentation. And she will tell you that this was coming forward just as we were going to press with the textbook. So this is all new material. So because we're faculty and because we love to give tests, we're going to start with a pop quiz. And as Sophie has indicated, in your right-hand corner there, you'll see that checkbox. And what I'd like you to do with the pop quiz is to answer yes or no. Here's the quiz for you. Ebola. If a person has been exposed to Ebola, has no fever, and travels on an airplane, can he transmit the disease to other passengers? And I'm going to give you some feedback music. Well, majority of you think yes, that it can be transmitted on the plane to other passengers. And the answer is not unless he's directly touching the person. And it's highly unlikely even in that case. So the answer is no. Human transmission is through direct contact with the blood or other body fluids of infected patients. So you can't get it on an airplane. The next pop quiz question, measles. If a person has measles, has no fever, and travels on an airplane, can he transmit the disease to other passengers? Remember the little feedback button on your right-hand side. Let's see what you think, yes or no. A 100% of you said yes, and that is correct. Measles is highly contagious, and in fact, you can get measles if you're in a room after someone has been in there coughing 2 hours later. It's transmitted by direct contact, but it's also transmitted by droplets. So aerosolization definitely works with measles. So next pop quiz question, pertussis. Quick question, just raise your hands. How many of you have heard a whooping cough? Just curious. So a small fraction of you have heard a whooping cough, which is, if you have a chance to Google it on YouTube or anywhere else, CDC has an example of it, a link to it. It is a deep, horrible, gut-wrenching cough, unlike any other cough you ever heard. Here, and you hear this wheeze, and quite frankly, when I hear it, my chest seizes up. It's a very scary thing with a child, and I'm sure you have seen the ads with the wolves. So, question, if a person has pertussis, has no fever, and travels on an airplane, can he transmit the disease to other people? And yes or no, let's see what you think. Excellent. 100% of you said, oh, here's 1%. It is highly contagious. It is aerosolized, and it is probably something no one wants to have. It's very contagious, and it's found in humans and spread from person to person. They usually spread the disease by coughing or sneezing while in close contact with others who then breathe in the pertussis bacteria. And this little boy in this picture actually has broken blood vessels in his eyes from coughing so hard. It's a really, really awful disease to get. Next up, polio. Now, in this picture, you'll see something that we, thank God, don't see anymore. These are iron lungs. And to show you my age, when I was growing up, and possibly when Dr. Shanks was growing up, we all lined up in the gymnasium to get our polio vaccine, which was very risky, very experimental, on sugar cubes. We don't have polio in this country now because of this, but we might be seeing those cases, so traveling in from other countries. So question for you, if a person has polio, has no fever, and travels on an airplane, can he transmit the disease to other passengers? Don't forget to vote with your little feedback button, and let's see what you think. Yes or no? It's about 50% response rate. Half and half believe that yes and half say no. The answer is it is very contagious. It spreads through contact with the stool of an infected person and droplets from a sneeze or a cough. So again, this is another disease that you don't want to have traveling with you on that plane. Next question, Zika virus. Now this is a double negative, so it's a little convoluted, so bear with us. Is it true that there are no risks for men associated with the Zika virus? Yes or no? Is it true that there are no risks for men who have the Zika virus? Yes or no? And I'm going to wait for your response. You are a really good group because you're correct. The answer is no. Zika virus is a risk for men. It's a risk in that it can be sexually transmitted to partners and has been transmitted to at least 24 cases in the United States as of this writing. We are moving into more research in this area, and I said before, Dr. Shanks will be covering this. And now you can take a breath and be relieved that you won't be hearing that awful music from me for a while. We are refocusing. While our eyes and ears were focused on Ebola, the rise of vaccine-preventable outbreaks has grown, and an old mosquito-carried virus has resurfaced. This isn't a new virus. This is something old. Immunization, thank God, currently prevents an estimated 2 to 3 million deaths every year. Measles, polio, pertussis, and influenza by themselves kill more people annually than Ebola did at the height of the last outbreak. And here's a chart for you here comparing these cases in the United States and global cases. As you can see, in the United States, we had 5 outbreaks in 2015. And worldwide, we had about 400 deaths a day, or 16 deaths every hour from measles. With pertussis, we had 10 to 20 children's deaths and 195,000 children's deaths in 2008 globally. Polio, none, free of the disease for 30 years due to the vaccine. In 2013, there were 416 cases reported worldwide. 1 in 200 infections leads to irreversible paralysis. Of these, 5 to 10% will die when their breathing muscles become immobilized. It's a horrible death. The next slide shows us influenza. Cases in the United States. In 2014-2015, we had 98,680 cases, 125 pediatric deaths, 90% of whom were unvaccinated. Those are preventable deaths. Global cases, 250,000 to 500,000, all ages. Ebola virus, 4 cases in the United States, 1 death. Globally, 10 countries, 20,272 cases, 7,953 deaths. Look at those numbers and just think about that. Flu killed more people than Ebola. Zika, well, what's going on with that? Locally acquired Zika cases, we found 43 cases. Travel-related, 2,920. Lab-acquired, 1. Sexually transmitted, 24. And Guillain-Barré syndrome coming out of Zika virus is becoming a bigger phenomenon as well that we're learning more about. Interestingly enough, the World Health Organization is not reporting case counts. They're counting countries that are impacted by it. 46 countries and territories have indigenous vector-borne transmission of the Zika virus. We have all, I hope, heard about the anti-vaccination claims. We still have people who say that vaccines are bad, that they cause all sorts of diseases, most notably autism. However, Wakefield's article was retracted. It was completely fabricated. He asserted a link between measles, mumps, and rubella vaccines and child autism. He made fears of making well babies sick rather than protecting them, swelled among certain groups. This man didn't go to jail in the United Kingdom. They're not in prison for this. He did lose his license. He was blackballed, but there's still groups who are Wakefield adherents who still believe to this and cling to this notion even after his work has been disproven repeatedly. Now, some of the fears were founded in well-grounded research currently, and some concerns about special populations and perhaps faulty vaccine preparation. And I can tell you that when I was at Albany Medical Center, we did see a case of vaccine failure for rabies. So you can have vaccine failure, but that's not the norm. That's the unusual. That's the outlier. Other fears are based on theories that Big Pharma is conspiring to make money by killing our children. What has remained in some parents' minds is not the fact that the physician Wakefield falsified the data, but that all vaccinations are bad, including those that have withstood the test of time, such as measles, mumps, rubella, pertussis, influenza, and polio. Well, due to lack of immunization in other countries, porous borders, global travel, parental refusal to vaccinate their children in this country, diseases we once thought were vanquished are making a comeback, often in tragic ways. We're now seeing a resurgence of our old friends, measles, polio, pertussis, and influenza. And I'm old enough to recall seeing these signs on houses near me when someone had measles. Quarantines were real, and it's something that could reoccur. Self-quarantine has been asked for certain cases of Ebola. Vaccinations do work. This link, when you receive this PowerPoint, the link will be active, and it will take you to an interactive map that's very telling. The dates are from 2008 to 2015, and I'll give you a screenshot from the next slide. This is later on. This is all the cases by region, but when you first look at this in 2008, the United States is pristine and clean. There's almost not a speck of color on it. And likewise, in the rest of the world, those dots are much smaller, much more random. But in this scene, you can see in this screenshot that this is not the case any longer. So we need to be concerned about this refusal to vaccinate, and we need to be concerned about how people are acquiring these diseases that are preventable by vaccine. So what about Ebola? Well, despite the magnitude and wildfire possibilities of the Ebola virus, which was taking thousands of lives each week in Western Africa, and who can forget the images of people carrying bodies across, in their hazmat suits? And how can we forget, all the furor that was associated with the nurses who were flying in the airplanes when they were, in fact, not contagious? There's an Ebola time series that, again, if you go to YouTube and look at this link, you'll see the blossoming of this from one case to thousands of cases, and it is truly like the wildfires in California when you watch this video. It's very eye-opening, and it's why we were so frightened. In the United States, we had one case, one death, 4 cases, 1 death. This is Thomas Ayers Duncan. He was patient 0. He came to Dallas, Texas Presbyterian ED on September 24, 2014. He was complaining of headache, fever, stomach cramps, and he reported a history of recent travel in Western Africa. Now, interesting to say that the nurses had received the week before training on Ebola virus. There was an in-service educational piece on Ebola virus that was given to all the nurses in the hospital. It took 2 visits to the ED for someone to put in the chart, maybe Ebola. So how prepared were the hospitals? Not very prepared. Remember the panic. Among the findings of the National Nurses United survey of 400 nurses that was conducted in early October 2014, 60% of the nurses indicated their hospitals were not prepared to handle patients with Ebola. 80% responded their administration had not communicated with them regarding any policy regarding the disease. 30% said they had insufficient personal protective equipment gear, no eye goggles, no fluid-resistant gowns on hand to protect themselves from bodily fluids, the main method of Ebola transmission. Basically, what the survey is telling us is that the nurses were prepared to take care of people, but they weren't prepared for the contagiousness, and they weren't prepared to protect themselves. So, our question for you is Zika the new Ebola? And I'm going to let my colleague, Dr. Shanks, carry the ball now. And I'll do that lovely Jeopardy music for you, Nancy.
Thanks, Sharon. Hi, everyone, and thank you for joining our webinar. Let's restart. This is a picture of a child born with microcephaly, which is a tragic and very sad result of some cases of Zika infection. So let's vote again using your feedback button on the right. Do you think Zika is the new Ebola? Thank you, Sharon. Looking at the results, your voting is really mixed. About half of you say yes and half of you say no. So let's look at this comparison between Zika and Ebola more closely. We know there are many parallels between Zika and Ebola. Both are viruses that are transmitted through sexual contact. They've both been found in bodily fluids. Both have been caused by contact with sick or dying patients. You may not have heard this, but in a case reported last summer, a 73-year-old Utah man who had traveled to part of Mexico where the Zika virus had been found became ill with Zika after returning to the U.S. and subsequently passed away. Another person who had visited the man in the hospital became infected after wiping the patient's eyes and assisting a nurse with repositioning the patient without gloves. So we're not sure if that person died of Zika because he was immune compromised, but we do know that the death was related to Zika. So while there are parallels, there are also differences, mainly because there are so many things about Zika that aren't yet known, such as whether the virus is transmitted in blood transfusions, how long the virus remains active, why some children of pregnant women are impacted and others aren't, and what the long-term impacts are on infants who initially don't appear infected. And most importantly, while there is a vaccine for Ebola, there is not currently a vaccine for Zika, although there are several that are currently in clinical trials. Clearly, the impact on society are much the same for Ebola and Zika. The death toll from Ebola, Sharon pointed out, is quite small in the U.S., but significant elsewhere. One of the consequences in Africa is that has left many children orphaned. While deaths from Zika aren't really known, we do know that 13% of mothers infected with Zika in Brazil delivered infants with microcephaly. Both of these diseases tax families and carry social stigma, similar to the AIDS epidemic of the past. Some mothers and infants with microcephaly in Brazil have been abandoned. A recent JAMA article has even suggested that Zika may be worse than thalidomide, which many of you will remember. All of this puts pressure on healthcare systems and governments, as well as on communities. And finally, since Zika is so new, there are other societal impacts that are only now becoming known. So what's to be done about this? Since the data from the CDC shows that there are several thousand cases of Zika in the U.S. and the territories, we need to be prepared and to address it better than we did with Ebola. Since so many healthcare workers are female and of childbearing age, healthcare organizations need to protect their workers. We must understand Zika better, and additional research is needed to answer questions about transmission, such as in blood transfusions or other routes, such as needle sticks. Healthcare organizations also must be prepared and have plans in place to deal with future outbreaks. Ebola was a good example for us about how many institutions were not prepared. Organizations are going to have to allocate resources to address this. The CDC has already put in place what they call rapid response teams to send to the field to investigate Zika outbreaks. In fact, they sent a team immediately to Utah to investigate the situation where the man had died. Hospitals may also need to have rapid response teams ready if Zika cases are identified in their institutions. And healthcare workers, including nurses, other providers, managers, need to work collaboratively, need to share information, and they need to be vocal and speak up if there are things not being addressed. So what are our lessons learned? We know that we live in a highly mobile world with extensive global travel. We know that these diseases are now global, and we have already seen outbreaks in some parts of the U.S., particularly in Miami, where the climate is hot and humid and where there is standing water that is conducive to breeding mosquitoes. In response, we need to learn from the past and thus need to be nimble, need to collaborate and need to be prepared and put in place precautions. And, of course, we need funding to develop vaccines, to develop more rapid diagnostic testing, and we need research, particularly longitudinal studies of Zika. All of this calls for a shift to collaboration, which is the main lesson from Ebola. We need to have increased and better communication amongst administrators, care providers, public health officials, even morticians, and others involved in the healthcare industry. We need more and better teamwork. We need to address and resolve whatever conflicts arise. We need to have shared information, and we need to address barriers and work to assure safety of both employees and patients and assure quality. So what this cartoon shows is interprofessional collaboration. This is what is needed, and healthcare providers need to be patient-centered and include everyone, including patients and families, in this process. We need to educate people on how to prevent getting exposed to Zika, and we need to educate people about how to address it when it arises. So let me now pass this back to Sophie to take any questions.
Great, thank you so much to both Dr. Buchbinder and Dr. Shanks. And yeah, at this point we are going to open things up for questions. And again, if you want to voice your question out loud, which we very much encourage you to do, simply press *1 on your telephone keypad, and Katrina, our operator, is on the line, and she'll open your line for you. Or if you want to type your question, you can do that using the chat or Q&A box. And I do already have quite a few questions coming through on both the chat and the Q&A. So why don't I start with some of those. So here's one question that's come through. What do I do if a student argues against vaccinations and says they make people sick?
I'll take that one. This is Sharon Buchbinder. Well, I see that as a teaching learning opportunity. I would offer this student extra credit assignment to research this question using peer-reviewed scholarly articles, not .com or even .org websites. He or she could do a paper or class presentation. Alternatively, you could use this as an assignment for the entire class, perhaps even turn it into a debate topic. The bottom line is students need to understand that healthcare management and public health policy are data-driven. Wakefield lied and fabricated data. He lost his medical license. Children died because their parents bought into Wakefieldism. So the costs of his unethical behavior are astronomical, and our students need to understand that, and that's what I would do.
Great. Thank you, Dr. Buchbinder. We have another one here about Zika. While we are waiting for a Zika vaccine, what should hospital administrators do?
I'll take this one, Sophie. Thank you. Clearly, we need public health triage. We need administrators to become very responsible for their own work environment. I mentioned the issue about caring for and protecting our female healthcare workers who are of childbearing age, but we also need to make sure that everybody is aware of how Zika is transmitted, that it can be, if it's transmitted by sexual contact, we need to educate people about that and encourage them to use condoms as we do relating to other transmittable diseases. But in addition, administrators really need to pay attention to the environment at their facility. We need to make sure that if there is standing water in a pond or whatever, that we are monitoring mosquitoes and we they're being careful about the places where mosquitoes will breed. We know in various parts of the country, communities have made efforts to eradicate mosquitoes and to use aerial spraying, but there have been some unintended consequences of that, such as in California, where a number of honeybees have been killed by the spraying. So we as administrators have to know that there are less toxic products that can be used, and we need to be sure that employees are educated, and we need to educate patients about how to prevent getting Zika. The Department of Health and Human Services have put out guidelines about covering up, using insect repellents, removing standing water, keeping mosquitoes out of our homes, using condoms, all of those things. Now, clearly this is more of a problem in the summer than in the winter, but it is more of a problem in the southern areas of our country, which where the weather remains warm. So there are lots of things that administrators can do.
Thank you, Dr. Shanks. And we actually have quite a few questions coming through about Zika. Before I get to those, I just want to check in with Katrina and ask if we have any questions coming through on the line.
There is a question from the line of Rosemary Nichols.
First of all, thank you for this. This is wonderful. I teach health, and we're in the midst of infectious disease right now. And yesterday we had discussed Zika as one of those new and emerging, although it's not really new. But I have a question. I came across something from the Bulletin of the World Health Association, which stated that in February of 2016, officials confirmed a case of Zika infection transmitted by transfused blood from an infected donor. And if that's true and it can't be transmitted via blood and blood transfusions, are we doing anything with regards to protecting the safety of our blood supply from this virus?
I don't know the answer to your question, I'm sorry to say. We have put together a list of references on Zika, and I had not seen that one from the World Health Association. But I think that clearly the CDC and the Department of Health and Human Services are going to be right on it in terms of issuing guidelines for protecting the blood supply.
I'm on the CDC website right now, and the CDC is saying it poses a low risk to the blood supply of the continental U.S., but this, once again, it's coming from WHO, so oftentimes they'll see things before we will in the United States. So I'm guessing by the end of today, this will be updated because if you recall during Ebola, there were lightning fast updates on the CDC website, I mean, almost on an hourly basis when I was following that and trying to, get up to date with it with our students, our nursing students, or health management students. It was, so I think CDC is going to be, as Nancy said, right on top of this.
Okay, well, great. Thank you very much. Thank you.
Thank you, both Dr. Buchbinder, Dr. Shanks. Katrina, are there any other questions on the line?
No, ma'am, not at the time.
Okay. And please don't hesitate if you want to voice your question out loud. Again, that's *1 on your telephone keypad. Meanwhile, to go back to the Q&A box here, there's, like I said, there's a lot of questions about Zika. Two questions here that I think we can wrap into one. And one is, what is the current status in Florida? And do we have enough cases of Zika to conduct case-controlled studies at this point?
That's a good question, and I saw that question about Florida, and there are alerts on the CDC website just today in terms of what neighborhoods are at risk for Zika. Nancy, did you see that also?
I think there are 3 of them, aren't there, Sharon? I don't know for sure, but go ahead.
So, I think,
but,
see if I...
Let me add one thing. I know that from some of the materials that I have read that the CDC is desperately trying to find funding, number one, to do various kinds of research. To do controlled studies where they begin to pull some of these patients who are infected into these studies, but very little has been done in other countries, particularly in Brazil. And here's a great example. You know, we said that 13% of the moms who are infected with Zika in Brazil delivered babies with microcephaly. In Colombia, which is a neighbor of Brazil, there were a large number of Zika cases in women who were pregnant, and only like 18 cases of babies born with microcephaly. So the question is why, and what do we know about the differences between these cases and the differences in these environments, or I'm not sure. But the problem is that they're late coming to the table to start these kinds of studies. I think they are doing this. The CDC has tried to pull money, despite Congress not providing funding. The CDC has pulled funding from other sources, in part from Ebola, to start doing various kinds of studies and to try to understand these issues. And I think that the WHO is also, you know, trying to do studies, but I think we are behind the 8 ball on this issue. And as you know, it takes a long time to do longitudinal studies that will look at, you know, if a mom has Zika and doesn't deliver a microcephalic baby, are there consequences in the long term? And we don't know that because it's the timing and the study of these moms and the children they're just getting started.
Great, thank you, Dr. Shanks. I do have a question here about Ebola. If there is a vaccine, why is it such an epidemic?
Actually, the epidemic's gone. Ebola's gone. It is a non-issue. Since the vaccine was effective, it worked, and it's no longer even considered an epidemic. There may be some sporadic cases that are out there in some remote areas where people haven't been vaccinated, but it has been, as soon as they had a vaccine in hand, the vaccine was deployed and it was found to be effective. There are volunteers, even as we were having panic situations here with nurses being put in isolation and, you know, choppered in from other areas, we were working on those vaccines here in this country, and that vaccine works, it's effective. So that is no longer considered an outbreak situation. It's amazing. I mean, so that's why we need to get on they're doing a vaccine test in mice for Zika, but obviously, you know, unless you're a mouse, you're not safe, so they need to do some more work on that. So, but yeah, we're good on Ebola now.
Good. Okay, I have another question about both Ebola and Zika. I am curious as to why one of the similarities was social stigma.
Because actually I have a student from Sierra Leone who has set up an orphanage for Ebola orphans, because even though there are now vaccines and there are now ways for us to prevent this, because their parents died from this disease, they had the same stigma that was associated with AIDS. It's clinging to the children. No one wants to take them in. Nobody wants to house them. And so she and some other students actually established an orphanage in Sierra Leone for children of Ebola. And the stigma is the same with Zika. People, if you don't understand the disease and you don't understand how you get it, and if there's no vaccine in particular, you know, women and children are not the first in the lifeboats, honestly, folks. They're oftentimes the last in the lifeboats when it comes to disease. And so these women are being stigmatized because of fear, and their children are being stigmatized because of fear as well. And these babies are very difficult babies. They cry constantly. They have a constellation of issues, and they're really, think of the worst night that you've ever spent with a crying child, and that is almost their whole life. It's very difficult to deal with an infant who has this. So I get it. I don't approve of it, but this is what happens.
One of the things I would mention, in one of the articles that I read, it talked about that microcephaly is just one of the symptoms of a baby that's armed, and that many researchers say it appears that the virus is also associated with deformities of hands and feet, trouble developing reflexes for sucking and swallowing, and vision and hearing loss. So, you know, physicians are concerned about, you know, what are the long-term implications of this, and they just don't know that yet.
Yeah.
So, again, it's an issue of fear and the need to study some of these issues better. I'm not suggesting that we can't deal with this, but we need to get a better handle on what's actually going on.
Great, thank you. And that actually answers one of the questions that we have here about other problems in Zika babies, including what they're experiencing, and also wondering what is their expected lifespan.
We don't know that.
Okay. I have another question here about both Zika and Ebola. As faculty in an NP, or nurse practitioner program, what are primary care offices doing to screen or set up rapid response teams for Zika and even for Ebola?
I don't know. That's the same problem that we had with physician practices with Ebola. All they were doing at the time that Ebola was a concern, quite honestly, was giving people a clipboard and checking a checklist of where have you been lately and have you been feeling ill. So I'm guessing that's pretty much the same standard thing that's going to be happening in clinics where you see a lot of people perhaps in high-risk areas of the country. I mean, thank God it's going to be winter soon in much of the United States, so we'll see some of this die down. But, you know, that's certainly part of those plans that need to occur in offices, and it is a concern. You know, just like hospitals are unprepared for Ebola, I believe they're unprepared for Zika, and our practitioners are unprepared as well.
So that speaks to education, that hospitals, medical societies, professional associations of all types need to be holding educational sessions to educate all types of healthcare professionals, and we as professors need to be educating our students about these issues, and they in turn need to be educating their families. And the lesson from Ebola is that we were kind of behind the 8 ball on that, and we now can learn that lesson, I think.
Okay. We have a question. Pathogens seem to be getting smarter and circumventing some of the vaccines we have. Is this a concern with Zika and new outbreaks of some of the other diseases that data was presented?
I'll speak to the other diseases. I'll let Nancy talk about Zika. The real concern about the outbreaks is that in influenza, we do see that mutate. We do every season. We have we have to look and see what is it this time. And I, as somebody who's turning 65, you know, and have asthma, I'm always on top of what is it this year, you know, with a swine flu combined with the other flu. So we have to be concerned about influenza in particular. The other pathogens, we have not seen that kind of mutation. What we have seen is people not vaccinating their children. Every study that you see where there's an outbreak, you'll find that there's a large number of people who've said, nope, not going to do it. There was an Amish community that didn't have vaccinations for measles, and many of them became sick, and quite a few died. So there's, while you may have religious objections to vaccinations, it is a public health concern, it's a public health policy. California got set up with pockets of resistance and outbreaks of measles and children's deaths, and they finally, liberal California passed a law saying you have to have your vaccinations before you go to school. Maryland, where we are, I'm in Baltimore, you don't go to school unless you've got your vaccinations or you have a really good reason for not having gotten them. My son had a very bad response to Pertussis vaccine, and he had high fevers. He didn't have seizures, thank God. But you have to have some real reason for not getting a vaccine or part of a vaccine. As a grandmother with twins and another child that came along shortly after that, I was right there in front of the line getting my vaccination for, DPT, so that I could be sure that I wasn't giving, I didn't want to be the wolf giving the baby the disease. So we need to be mindful that, it's very easy for us to forget because we are so safe, relatively safe compared to the rest of the world because we are so highly vaccinated. We think, well, we have herd immunity. It's okay, we'll be fine, but it's not true. We have to be vigilant, we have to stay on top of it, and we see why, because we have these resurgences, and I'll shut up and let Nancy take over.
Well, as I said, we don't have a vaccine for Zika yet, and we don't even have diagnostic tests that can be used that don't take days to be analyzed. So part of what the government is doing is trying to get these vaccines. I think one of the articles said that there are 2 vaccines that are being tested at Pitt and a couple of others that are being tested elsewhere. And part of this is instead of us, it goes back to this issue about collaboration. Instead of everybody being totally territorial and closed-mouthed about finding solutions, everybody in terms of the government, the CDC, the HHS, and everyone are trying to get people to work, scientists to work collaboratively and to share information and to get create a vaccine and these speedier kinds of diagnostic tests sooner than later. But how long that's going to take, I'm not sure we know. As Sharon said, they've already been tested. The vaccines have already been tested in animals and are now going into clinical trials. But how long that takes to get to the point where it can be distributed and used in this country and other countries is still up in the air.
Great. Thank you, Dr. Sheggs. Let's see, quite a few more questions here, and I think some of them you've partly answered, but let me just jump in right here. Zika has been around since the 1940s. Is there some trigger that has led to the acceleration or incidence of microcephalic infants?
I don't think we know that because we don't have the research. I'm sorry to say.
Yeah. One article I did see indicates that, it's from the Smithsonian, and I'll put this in a little box, is that Zika seems to be spreading now and reemerging now because of deforestation. There's also some theories that global warming has caused this as well. So between deforestation, global warming, we have increased animal carrying of this. Remember that, good old public health model, the triangle. Where is it in the triangle that we can cut off the transmission of this disease? And so we need to somehow get between the mosquito and the person. But, then when we have person-to-person contact, then it becomes a whole other animal. But there's so far, I don't think we know conclusively, but there seems to be some evidence that are pointing to this act of deforestation.
Great, thank you, Dr. Buchbinder. Have another question here about the spread of Zika. How far north into North America has it spread? Are there cases in Canada?
Why, yes, there are cases in Canada. There were 2 that were reported, and there were 24 that came from out of the country. So Canada has been pretty much protected because of their climate. So they don't have the mosquito problem we have. Although I will tell you, I was in Alaska and I had been told that the mosquito was a state bug, state bird rather, but I didn't see that fortunately when I was there. So, but that's always a possibility. And Alaska has had cases of Zika. Every state in the country has had cases of Zika, and Canada has too.
Well, and the CDC updates that information almost on a monthly basis. So there is something called Cases of Zika virus disease in the United States. And if you just, I think it's done by the Kaiser Family Foundation, but the data come from the CDC, and they update that information every month. So I'm sure that these other countries are beginning to track that as well. But for instance, there are only 8 cases of Zika in New Hampshire, while in Maryland there were 89, and in, Mississippi there were 20. So it's not clear. I think that the hubs in the United States are clearly the same hubs that we see frequently, which are California, Florida, and the New York, New Jersey area.
Okay. I have a question here about vaccinations, but before I read that, I just want to check in with Katrina to see if anyone would like to voice a question out loud.
Yes, we do have 2 questions via the telephones. The first question is from the line of Denise Curtis.
Hello. Yeah, my question was answered. I wrote my question. I just wanted to make one comment regarding the answer from one of the presenters. I am an epidemiologist by training.
Oh, good.
And so you say correctly that doing longitudinal studies for Zika are going to be very long and costly. That's why it's important, and I imagine the CDC and the the PAHO may be already doing case control studies, because those are faster and less costly. The thing is that I don't think we have enough cases in the States to do a robust case control study. That's why probably the studies may have to be in Brazil or Colombia. That way they can select those mothers that had the babies with, with the disease, and look retrospectively and see at what factors they were exposed to. So that was just my comment.
Yeah. Thank you.
Great. Thank you for sharing.
That's great.
Go ahead. You have another question on the line.
Yes, ma'am. It comes from the line of Rosemary Nichols.
Yes, thank you for taking a second question from me. I was wondering, I'm not sure if you folks have the answer, but, for those of us that are concerned about global warming and environmental change, are we concerned, or do we have any evidence that Zika is moving or has the potential to move to higher latitudes, sort of more aggressively? Do we have any idea?
I don't think we do. I think that data are really preliminary, and I think this is research that's just sort of surfacing from my experience, that, there's ecological public health researchers that are looking at this. So I don't know if they're going to be able to predict it, but again, I think it's going to vary with the temperature, and if we have a good hard cold snap this winter, it will slow it down, but it will be worrisome wherever there's an opportunity for standing water and for mosquitoes to grow. We're always going to have to be worried about that. So yeah, it's a good question. I think we wait and see.
Yeah, thank you.
Okay, and we're getting close to the end of the hour here. I do want to get in as many questions as possible. Katrina, do you have any others on the line?
No, ma'am, not at this time.
Okay, well, I will ask a few more questions, and then I think at the top of the hour we'll go ahead and wrap it up. But like I said, there was a question about vaccinations. And Dr. Buchbinder, this one's probably for you. How can you respond to the statement that government should not mandate vaccinations for children and adults? For example, the statement might be, the government should not make healthcare decisions for me and my family.
Okay. That case has, that statement has been seen in court many times with parents of children who have, diseases that are treatable. There have been cases where the children have been removed from the home, put into foster care, and treated for diseases such as diabetes, for diseases such as hemophilia. So there is a precedent. So basically, and it's gone to the Supreme Court. So I would say to the individual that while they, may feel strongly that the government should not make decisions for them or their family, their children's welfare will come first. And in many states, if children aren't taken care of medically, it's considered child abuse and neglect. And also, we can say that we have a right to protect other children. If you don't want to immunize your children, then you can't go to school. You can't come into our school without your immunizations. You can't take advantage of other things as well. So if you want the rights and privileges that the rest of society has, then you're going to have to make a decision. You can stay home and homeschool your children, and then when they go to college, they're going to have to prove that they have these immunizations if they go to college and go to a campus. And again, they do check the immunization records when you go to college. So that would be my response to the student, to do the research and to look at the legal precedents, because there are plenty of them.
All right, great. Thank you, Dr. Buchbinder. I'm going to go ahead and take one last question. I apologize if we didn't get to your question. What I'm going to do is try and capture all the unanswered questions, and we will try our best to get back to you with answers to those. But for the last question, seems appropriate for the timing. Are either presidential candidates making statements on more funding to fight these tragedies?
Not that I'm aware of.
No, I haven't heard anything specifically to that effect. I haven't heard anyone talk about Zika in the presidential campaign. There's an assignment for your students.
Yeah.
Okay, well, thank you, Dr. Buchbinder and Dr. Shanks. Before we wrap it up, I just want to say that if you, a lot of this material, not so much the Zika, but a lot of what Dr. Buchbinder was talking about with measles and Ebola is covered in the new Chapter 17 of Introduction to Healthcare Management. That's the new 3rd edition. It just published in March. And you can learn more on our website. You can find the book either through a title or author search. If you're interested in adopting the book for your course, we're happy to send you a complimentary review copy. You can reach out to me directly. You can also make that request on our website, and I will be following up after the session with an email with instructions for how to do that. The other thing I would mention is if you're on LinkedIn, I very much encourage you to continue the discussion on our LinkedIn Public Health and Health Administration Faculty Lounge. You can go right to that group at go.jvlearning.com/PHLinkedIn, and if you join, I'll pull you into the group and would love to continue the discussion there. So with that, I think I'm going to go ahead and first thank you very much to Dr. Buchbinder and Dr. Shanks for your excellent presentation and all the answers to the questions.
My pleasure.
Yep, it was fun. Thank you all for participating as well.
And at this point, I'm going to ask Katrina to go ahead and close out the session. Thank you very much.